Good evening, everyone. Welcome to another edition of Q&A Wednesdays with J. Lopez, MD. For tonight's topic, it will be called All About Eboo or Extracorporeal, Blood Oxygenation, and Ozonation. Again, this is Dr. Joel Lopez, your host for tonight, and we have a couple of guests. Our first one is a graduate of St. Luke's Medical Center. He actually practiced holistic medicine at the Farm San Benito, and it also focuses on acupuncture. He joined our practice less than a year ago. Let's all welcome Dr. Sigfried Galang.
Hi, Dr. Joel.
Good
I'm
evening,
back.
Sigfried. How are you doing?
I'm doing fine. How about you?
Good. I'm good, thank you. Yeah, our topic for tonight is quite interesting, right?
Yes, definitely. It's
Yeah,
about Eboo and
yeah,
ozone, medical
yeah.
ozone.
Great. We have another guest for tonight. She's a graduate of LaSalle Medical School. She's been interested in holistic medical modalities for a while, and currently she's one of our junior doctors. She's also currently studying medical acupuncture. Let's all welcome Dr. Bella Espino.
Hi, Doc. Hi, Doc Joel. Hi, Doc Sigfried.
Guys,
Hi, Doctor.
how are you doing?
I'm okay, Doc. I'm excited for this
Great.
Q&A Wednesday.
Yes, we have a very interesting and what do you call this? Um, Special topic for tonight.
Yeah,
Yeah.
yeah.
Should we begin? Our title again is all about Ibu for those who are joining us just now. And for the first topic, it will be about ozone. Take it away, Dr. Fred.
Okay, so the first question is what is ozone? Actually, when I hear about ozone, what I think about is the Earth's atmosphere. There is this ozone layer that has a lot of ozone. And as this ozone layer is actually a sunscreen which protects us from the harmful effects of the ultraviolet radiation of the sun. So it reduces the harmful effects. And then it's actually produced when the stable oxygen, which is composed of two atoms of oxygen, is exposed to lightning, and then it converts to the unstable O3, which is ozone. This is composed of three atoms of oxygen. So this is where the ozone is produced. So actually, ozone is a respiratory irritant. On the ground level, it can combine with nitrogen dioxide, which is actually can create smog. So that is ozone.
Okay. Yeah, so ozone has been used medically as well. So it's
Mhm.
been used in hospitals to actually disinfect certain areas like the operating rooms and uh, you know, um, the rest of the hospital. Yeah,
Yes.
so that's what they use ozone commercially for. But yeah, as you said, ozone could be harmful if it's inhaled. It could cause like shortness of breath and also trigger asthma symptoms.
That's
And of
correct.
course, yeah, and of course, it's got the protective function for the earth, like you said. It
Mhm.
would prevent the radiation that comes, harmful radiation from like affecting us significantly, and that's what
Yeah.
that's why depletion of the ozone layer, which has been quite in the news in the past, is really important.
Yeah,
So
that's
for
why they banned CFCs, which is
yeah,
used in spray nets
Mhm.
and in air conditioned machines also, because that depletes the ozone layer.
yeah, right,
Yeah,
yes,
there's also in industries like
hmm
um they use ozone to purify instead of using chlorine
hmm
for cleaning the or sterilizing the water. They use ozone and
hmm
also purifying the air, for its antibacterial, antiviral properties. I think they use that too
hmm
in those industries.
yeah, and they actually use it to disinfect like vegetables. So
Mm.
especially for health conscious individuals, they use that form of disinfection of our
Mm-hmm.
produce. Yeah, so for our next question, what is medical ozone?
So medical ozone therapy. Actually, because of technology, we are able to mimic the effects of lightning to create ozone from oxygen. So they create these ozone generators in the late 1800s. So actually, we said that ozone is harmful, but it's actually in the dosing. So we use controlled therapeutic doses in application to medicine or in treating our bodies. Actually, Dr. Abella will discuss later the many ways that medical ozone can be used in the body. So this has been benefiting men since the late 1800s, and actually in 1896 Tesla created the ozone generator. So that's why we ozone became so popular at that time until it was buried. And then it's resurfaced during the World War I, where they used it for treating wounds. So prior to the advent of antibiotics,
Okay, great,
so they were
great.
using ozone to treat wounds for
Mhm,
infections, but there's no antibiotics at that time.
mhm. Yeah, actually, medical ozone has been popular in Europe all this time. So back in the late 1800s, it's been used in Germany primarily. In the US, it became more popular during the late 1980s. So
Mm-hmm.
several doctors in like 13 states have been practicing this modality widely. So this they've been using it primarily for chronic infections such as that caused by Lyme disease and other conditions involving poor blood circulation as well as toxicities and chronic inflammation. So anything to add, Bella?
I think
Has been,
you guys said it all.
Actually, not just Germany and some states in the US, isn't it,
Ah,
docs? There are also other countries that are utilizing these ozone therapies,
yeah,
mhm.
like
yeah.
I think Russia,
Russia,
Cuba,
Ukraine,
Ukraine, Austria.
India as
So there are
well.
lots of countries.
Mm-hmm.
How
Yeah.
about India?
India, India.
Yeah, India.
Actually, Japan, Malaysia as well, and a few
Oh,
doctors.
there's a lot of countries, yes.
Here.
Yeah.
And the Philippines.
So, what's our next question? So, what are the methods of administering ozone therapy?
Okay, so there's quite a few methods for administering ozone. Um, there's major autohemotherapy and minor autohemotherapy. It's putting or getting blood in a syringe or in a bottle, and then that blood will be oxygenated outside. And then before uh, it's returned to the patient. You can also do ozonated saline. You can also do bagging. So with bagging, it's usually used in wounds, burns, gangrenes. You put ozone resistant plastic and cover it and put ozone gas on that bag so that the wound or the wound would be ozonated. Um, they also do insufflations. So you can do nasal insufflation, ear insufflation. They do rectal and vaginal insufflation. Those are for local inflammations or local infections. No? So there's also what they call hyperbaric ozone therapy using 10 pass. So 10 pass is it's just like major autohemotherapy done 10 times, kind of like that. Um, and what we have here in the clinic is what we call EBOO, or extracorporeal blood oxygenation and ozonation. It's also called recirculatory hemoperfusion. So that's what we want to talk about and clarify more. So EBOO, or extracorporeal blood oxygenation and ozonation, it's a procedure where we get a venous blood, no? The venous blood is continuously flowing in a series of sterile tubes and filter. It's these tubes and filter is ozone resistant, no? So once the blood is once the outside blood, that's going outside of one side of your arm, would pass through the filter, and then once it's cleaned, your blood will be oxygenated as well as ozonated, and you would see the difference in color already in that state, and then it will be returned back to you. So that procedure would take about an hour to an hour and a half maximum. But average, usually what we do is an hour. And then we take this procedure very seriously. So our trained nurses and us doctors do the procedure very meticulously and by the book. No? And we also stay with the patient during the treatment. So that's how we do the process here in our clinic. So do you have anything to add with what I said, doctors?
I think
About
that's great.
EBOO?
That's
Yeah,
great. A lot of ways that we can use medical ozone.
Yeah.
yeah, exactly. So for our next question, so actually Bella already answered this. So what is EBOO and how is the process done? So basically, right now we're going to discuss about the benefits of EBOO. Well, there are numerous benefits associated with EBOO, and it includes improvement in blood circulation, cellular healing, as well as cellular oxygen utilization. It also activates the immune system in infectious diseases. It improves the cellular utilization of oxygen that reduces ischemia in cardiovascular diseases and in many of the infirmities of aging. It also causes the release of growth factors that stimulates damaged joints and degenerated discs to regenerate. It can dramatically reduce or even eliminate many causes of chronic pain through its action on pain receptors. And finally, published papers show that its healing effects on interstitial cystitis, chronic hepatitis, herpes infections, dental infections, diabetes, as well as macular degeneration.
So it can also
That's
be
a lot
used
of
for
benefits.
dental purposes.
Yeah,
Dental.
actually, a lot of dentists use this for infected root canals. So instead of using antibiotics, they use ozone therapy instead. And we've spoken to a lot of biological dentists, and they are really getting good results when it comes to chronic dental infections.
Yeah, Doc, you mentioned it's good for chronic pain, like joint pain.
Mm-hmm.
I didn't mention earlier, but ozone methods of ozone administering ozone. They also do prolozone
Yeah.
therapy.
Mm-hmm.
So they have a cocktail of I guess minerals, vitamins, and like collagen boosting. Uh, what's this factors,
Substance.
and then they would ozonate it,
Mm-hmm.
and then directly inject it to the area of pain or the the injured area, and then
Yeah.
usually they get good results from that.
Mm-hmm. Great. Okay.
In addition to that, I heard docs, you can also ozonate olive oil so that it can be more potent.
Yes, you can do that actually, and it's being used or applied topically to certain parts of the body that need to be treated, such as skin or
Mhm.
soft tissue infections.
Oh, that's
Yeah.
great.
They also do sauna, ozone sauna.
Hmm.
Mm,
So yeah, that's also good for skin infections as well.
Hmm.
amazing.
A lot of these modalities are actually done at in the states. It's called medispas. So these are clinics that
Mhm.
have spa services as well. So they do the ozone saunas and the hyperbaric ozone therapy. So just so many ways to administer ozone. And
Yeah.
as long as it's being done in a clinical setting with supervision done by doctors, it shouldn't be a problem. So for our next question, let's see. What's our next question?
What are the
What are the
indications?
indications?
Yeah, so there are um, a lot of indications when it comes to EBOO. Among them include severe peripheral arterial disease, or those people with like really poor circulation, those with cardiac ischemia, or those who have poor circulation to the heart, those with severe dyslipidemia or abnormal cholesterol levels, those with necrotizing fasciitis, which is a severe infection that requires immediate antibiotic use as well as surgery sometimes. So there are doctors who actually use ozone therapy instead. And
Mhm.
of course, it's also good for severe bacterial infections that are resistant to antibiotics, those who have ischemic stroke, those with chronic heart failure, those with viral hepatitis, such as that from B and C, acquired immune deficiencies, chronic inflammatory diseases or processes, including like arthritis, and for pre-treatment for patients who are planning to undergo antiviral therapy medication. So those are the usual indications for EBOO.
Mm.
Yes, docs, I heard that it was also used for Ebola virus before, the
Mm-hmm.
ozone therapy. It was able to help a lot of people save their lives in, I think, in
Mm-hmm.
Africa when it was
Mhm.
an outbreak of Ebola virus.
Yeah, that's true. And I won't
Okay.
mention, but it's also being used for another more more.
Yeah.
Yeah. Yes.
What I mean. So now we go to the contraindications of EBOO.
Okay, so for the contraindications, G6PD deficiency, we that's an absolute contraindication, and also for pregnancy, we don't accept those for ozone treatment. Also, those patients with anemia, since we're getting blood out, right? Um, and also unstable conditions
Mhm.
and acute conditions like recent myocardial infarction or or unstable respiratory conditions.
Mhm.
Also, hyperthyroidism or thyrotoxicosis, thrombocytopenia, those with platelets less than 50,000, um, 50,000. Also, those with who experience hemorrhage, um, uh, those who had like acute or alcohol intoxication, um, and blood and bleeding, blood and coagulation disorders. So that's usually the contraindications for the treatment, specifically for EBOO.
Mhm.
Mm-hmm.
And
You have
contraindications,
any?
toxic free.
Sir. Doc. So
Any
we
other?
test for G6PD, is it? We,
Yeah.
we test for G6. So there's a test for G6PD to know if somebody is deficient. Although we also screened that when we were newborns,
Mhm.
but sometimes
Yeah.
we forget. Yeah. So that's the absolute contraindication. Is that correct, Dr.
Yeah.
Bella? Yeah.
Yeah.
Yes. Yes.
Okay.
Mhm. So now we come to the side effects of Ibu treatments.
Okay. So when during the procedure, there are potential adverse effects that we can encounter, like for example, sleepiness, drowsiness. So actually, when I had that, I experienced that. So when usually they get sleepy, we just allow them to sleep. Yeah,
Mhm.
it can be rejuvenating. Then there's also possible weakness and transient low blood sugar levels or hypoglycemia. That's why we have emergency meds that we can offer like D5050. So it's also important that a person eats or the patient or client eats first. I mean, not full and not too fasting. So not too prolonged fasting. And then there's also slight dizziness, lightheadedness. And then there's also local swelling and irritation in the site of insertion. So, so those are the potential adverse effects, including temporary blood in the urine, but this is just transient.
Okay, great.
Y- Yeah, Doc. You're correct with we always inform our patients beforehand that they need to be hydrated, well hydrated, and they ate something before, not a heavy meal before the
Yes,
treatment
yes.
because of those potential side effects. And also, we want the procedure to flow smoothly. And if the patient is not well hydrated, well, I will tell you my testimonial later. But
Yes, yes.
yeah, it could lead to um, difficulty in the blood flowing outside
Mhm.
your body. So
Yeah, so it's really very important that the we are trained that are handling the patient during the procedure so that we can address these potential adverse effects.
Yeah, it's really important to individualize treatment. That's why,
mhm,
for those who have been inquiring about Ibu, we don't really necessarily allow everyone to undergo the procedure unless
yeah,
they have a complete consultation or pre-screening with us. Because again, if a person has like G6PD deficiency, then they could run into problems while they're doing the procedure. So yeah, this treatment is really highly individualized. We recommend it for those who really need it, but for those who want to do it as a preventive, it's allowed. Again, as long as we screen them for G6PD deficiency. Yeah. Now here we go. What are the common misconceptions when it comes to Ibu?
Okay, Doc, you
I
can
guess
start
that
with the
yeah,
most common
the,
misconceptions.
What is that? What's the
the
first?
legality.
The
Oh yeah,
legality.
regarding
So that's the
legalities.
usual misconception.
Yeah, because whenever a new procedure is being brought to the forefront, like or in the media, the first thing that people ask is if it's FDA approved. Actually, this particular treatment, well, ozone therapy in general is not FDA approved. It's not FDA approved. So, however, since each state is independent, it's like considered as an independent country. These states are able to practice or allow the practice of ozone therapy since they have legislation when it comes to complementary and alternative medicine. These are there are about 13 states that do this, and one of the most uh, popular states that does this ozone therapy is the state of Nevada. So basically, well, in Europe, when it comes to the practice of ozone therapy, they have an organization similar to the FDA, US FDA, but they're not as strict. In fact, in Germany alone, there's like 7,000 doctors who actually practice ozone therapy. And of course, as we all know, the organization called International Scientific Committee on Ozone Therapy is actually based in Spain. So a lot of European countries have been allowing the use of ozone therapy. So when it comes to FDA regulations, formerly it was only primarily for food and drugs, but later on they actually included medical devices as well. And currently in the Philippines, as of 2019, there were no requirements when it comes to medical devices, but I think they're now working such that they'll be requiring registration of medical devices soon. So actually, we're working on it when it comes to the legislation here in the Philippines. So that's number one. So the second
Okay.
misconception, um,
Yes, the second misconception is actually a lot of people thought that Ibu is actually like hemodialysis, which is actually there are a lot more differences than similarities between Ibu and hemodialysis. So actually, Dr. Abella mentioned it already, like the contact used or the contactor used in the filters.
mhm,
So for the hemodialysis, they use certain components that are sensitive to ozone. When they interact, they can cause toxic byproducts. Okay, so toxic byproducts. So in Ibu, there we're using the polypropylene material, which is resistant to ozone. So that's one difference. Another difference is the blood access. In the hemodialysis, we're using one arm only, and then we do AV fistula. But in the EBU, we're using two arms, using vein in each arm. One is for blood going out, and the other one is for the blood going in, which is already ozonated and oxygenated and filtered already. Then another difference is in the primary goal of each procedure. For example, for hemodialysis, the primary goal is to filter, to clean the blood, acting as an artificial kidney. The machine acts as an artificial kidney for diagnosis of kidney failure and those with kidney diseases. And then
Mhm.
for IBU, we can help people who are healthy, having functioning kidneys, and the purpose is also actually to increase the exposure of the blood to ozone and oxygen to optimal functioning of the organs, internal organs.
mhm. Okay.
And
Yeah,
actually,
and
another difference would be the duration, no, Doc? I
mm,
think
Mhm.
longer ang hemodialysis. Ang IBU is just shorter period of time that we apply the procedure.
Yeah, usually it's
yeah,
only 1 hour for Ibu and
mhm,
about
Yes.
3 to 4 hours when it comes to hemodialysis.
Yeah,
mhm,
I work in kidney dialysis before, and it's really long. It's not
Yeah.
as long
mhm.
as what we're doing in the IBU.
And like you said, that most people feel drained after the procedure, right?
Yes,
Yeah,
yes.
that's what I wanted
Yeah,
to add.
potential adverse effects, yes.
Mhm.
Yeah. So that's one of the differences too. Because
Yes.
Yeah.
people feel energized like after the Ibu because you actually oxygenate the blood.
Mhm.
Yes, yes. So that's one different also. There's no oxygen ozonation in the hemodialysis, while in the IBU there is.
Mhm. Yeah, and also you also brought up the difference between the tubings that they used.
Mhm.
So it has to be ozone resistant. So oftentimes in Ibu, they use glass or polypropylene.
Yes.
Polypropylene, yeah. So those two materials, because otherwise, if you use other materials, then it would cause or create toxic byproducts. So you're actually defeating the purpose of the procedure.
So yes, definitely. That's why we correct it now that they're two different procedures, and they're not totally the same.
Mhm.
Yeah. Okay, so the third
Third misconception.
misconception is the safety of the treatment. So, like I think I mentioned earlier that um, the therapist or the medical staff are trained to do the procedure, um, and for the whole duration of the procedure, the nurse or the doctor is there to oversee the treatment, even if it's going smoothly. Um, and why we do that is because we want prevention of the side effects, the potential side effects that Doc Sigfried mentioned earlier. So it's better to be well trained and be focused, be uh, um, what's this? Uh, we oversee the treatment from start to finish because we don't want those potential side effects to happen. And if a simple side effect happens, we can mitigate that immediately because we are there in the scene. Also, well, that that's what I can say about the safety. Do you have anything to add?
I think that's well said, Bella.
Yeah.
So, is that about it? Any other misconceptions?
Yeah, there's another
um,
one.
yes. I There's also a misconception that healthy people can't do it.
Oh, okay. Okay.
Yeah. What can we say about that?
Yeah, actually, healthy people can do it as a preventive.
Mm-hmm.
Um, there are those who say that since a person may have healthy kidneys, you don't need to do the procedure. But actually,
Mm-hmm.
if a person has, let's say, is dealing with like chronic infections, if they have toxicities, which most regular practices don't screen. So, like for myself, for instance, I found out through testing that I have elevated mercury levels. So this is just one way of detoxifying my body from these toxins by using this procedure. Because again, Eboo actually takes care not only of infections, but of it takes care of toxins as well.
Mm-hmm.
Yeah. So in summary, or uh, basically, Eboo can be used as a preventive as well.
Yeah.
And there's
And
an,
if
an
I can,
analogy, Doc Bella, that you like, diba, to compare.
yeah, it's been told to me by the doctor who trained me in Ibu. His analogy was it's like cleaning the changing the oil of your car.
Mm.
So you do that. So you do that to um, maintain your car at its best level, at least, right? And for us, I think there's really no true perfectly healthy person,
Mm.
especially with the environment we live in right now. So there's pollutants, the food that we eat, right? So there's toxin buildup, um, which toxin buildup in our body, which is different from person to person. That's why we personalize our management here with our patients, right?
Mm.
Um, so there, for this treatment, we can do it um, in a safe way by doing consultations first with a proper medically trained uh, doctor. Um, and once this treatment is recommended to you, it's usually a difference in the frequency, right, doc, of
Mm.
uh, how many times does that uh, person need to do the treatment, or yeah. So
Okay, great. Thank you.
there.
So, all us three were able to do the Ebu actually. So, what is your experience when you had the Ebu, Doc Sigfrid?
Wow, the first time I did that, I was so sleepy. Yeah, I feel like I feel my body's resting.
Hmm.
So I had a good sleep afterwards when I went home. I had a very deep sleep. So I know deep sleep is a rejuvenating and restorative type of activity. So I know I was energized. Actually, it's good because I have chronic fatigue. So it's really beneficial for me to do Ibu. I did already 3 sessions of that. So it's really contributing to my recovery from fatigue.
That's great. How about you, Bella?
Okay, so um, I've done Ebu since 2017.
Hmm.
It was introduced to me, and then actually, I was since I was new in the field, I was quite skeptic of the treatment, but I kept an open mind, and
Hmm.
then um, that's when I fell in love, or like I really love the ozone treatment, like this type, the Ebu. I really like doing it for myself. And if I have a patient that's suitable for the treatment, I would recommend it. Um, so for me, the first time I did it, uh, well, I need to do it because I'm training, so I need to know how the process feels, and how I would feel after the treatment. So knowing myself, I didn't like. I thought I was healthy back then. Um, when I did the treatment, my blood flow was not good. So they kept on resetting it. First is because I wasn't hydrated. So that's why we really encourage everyone to hydrate. So that was my lesson back then. And then I saw that there's like yellow fat plaques coming out, and that really surprised me. And seeing the filter filled with those yellow fat cholesterol, they say it, that's in the filter. Uh, it felt like um, my body is being cleaned. I see it being cleaned. And after the treatment, there's nothing. It went smoothly besides my blood flow because I wasn't hydrated. But after that treatment, that night, I really had a deep sleep. And then I felt like my energy was sustained for a few days, um, which is uh, different from my usual back then. So I kept doing the treatment for every 3 months or every 6 months, um, just to get, clean my blood and my circulation. So
Great.
yeah,
Thank you.
that's my experience.
Yeah.
Great. How
Yeah. So
about
for
you,
my
Doc?
Yeah, well, I tried it because first off, I want to experience it before recommending it to my clients. That's always been my principle when it comes to recommending treatments to others. I want to make sure that I have experience doing it. So, when I first tried it, just like Siegfried, I felt so sleepy during the procedure. I was trying to keep my eyes open because there were people around, a lot of people around because the staff was training as well. So after the treatment, I felt a lot of energy, but I decided not to work out because, of course, I still had some heparin in the blood because that's what we use as an anticoagulant for the procedure. But in general, I felt really well after the procedure, and I would highly recommend it to people who want to stay healthy. And for those with medical conditions, of course, it's really important to consult with your holistic medical doctor first prior to doing any procedure, just to rule out anything, any possible problem that could cause side effects, like what we mentioned earlier, an absolute contraindication to Eboo, as well as, let's say, high dose vitamin C, is
Mhm.
G6PD deficiency. Yeah. So that's my experience with Eboo. So,
Actually, honestly, I was scared to do it at first in my initial because there
mm,
were two veins that need to be to be used. So, but I trusted because the people who are around me are trained for
mm,
the EBU procedure. So I'm curious also how it works. So once you do it, actually the fear goes away. It's just as simple as giving blood donation, and receiving blood, your own blood, which is more oxygenated and ozonated, more cleaned.
mm. Okay, great. Thanks for sharing your testimonies with us.
Thank
So
you.
I think we've run over our 30-minute time here.
Okay,
So,
it's very
yeah,
interesting topic, as it though.
yeah. And I don't think we have any questions from the audience at this point. So we would like to wrap things up. Again, I'd like to thank both of you, Doctors Bella and Dr. Sigfried. Thanks for enlightening our audience for tonight about ozone therapy, and of course about Eboo in particular. So that goes for our show for tonight. We would like to thank everyone for joining us. And if you do have questions or concerns, please do call the office. The number is right here below, or you could also check our Facebook page as well as our YouTube channel. Once again, thank you so much, everyone. Thanks, Bella and Siegfried. Have a good night.
Have a good
Good
night.
night. Thank you.
Bye bye.